Which you feel like this is not meant for tall people. Can you guys, I don't want to, okay, if I do this,
Yeah, still hear you.
you can hear me okay? Okay, I'll just talk like this. This seems too technologically savvy for me. I'm rapidly becoming old enough that I can't handle this. As long as you can all hear me like this, I'll stay. So it's so nice to see everyone here today. I wanted to share a little bit about my background. If I haven't met you already, I am a researcher working in the NF clinic at Mass General. I've been here almost 15 years. My anniversary is in 2 weeks. So I've loved working here. And I wanted to share a little bit about my background. So you might have seen something like this about the clinical translational research spectrum. So I explain this as kind of like this is the relay race we're all running to try and improve NF care. And it starts all the way at the basic science in the labs, some of the stuff you'll see in the lab tours if you stay tonight, all the way till clinical trials, getting things from, flies to mice to humans to actual benefit. And then what I focus on is actually this very last stage of this relay race, which is called health services research. And what we really focuses on is once we know a drug works or how to diagnose a disease or what care guidelines to follow, how do we actually get that into practice? How do we make sure that that's accessible to everyone, no matter where they live, especially for folks who maybe don't have the opportunity to come to an amazing place like Boston for their care? So really the goal of my research program is to try and ensure that all NF patients are going to receive high quality care, no matter where they live, what insurance they have, what kind of education or background they have. So I don't need to tell you guys that NF1 is a very complex syndrome, and it can predispose people to have a very wide range of physical, cognitive, psychosocial issues. So not that everyone develops all of these things, but that everyone has a slightly higher risk compared to the general population. And this kind of changes over time. So there are different things that might happen at different points in your lifespan. So it could be very early on that we, for example, notice some of the skin issues that people have, these cafe au lait spots or brown spots on their skin. And then it might be as they're getting older that we start to see other issues. Maybe we notice that vision problems are starting to happen or scoliosis is starting to happen. And this happens all the way actually up into adulthood, where people can be developing new skin tumors, so the skin neurofibromas, and they might be at increased risk of certain cancers like breast cancer, or developing hypertension, which is high blood pressure. So really throughout the lifespan, from kids all the way to adults, no matter what your age, people need this regular care. And luckily, we do have specific guidance on what that care should look like from the American Academy of Pediatrics, which oversees children's care, and the American College of Medical Genetics and Genomics, which oversees it kind of has issued guidance for adults. And in work we've done, we say, NF specialists really agree with this guidance. It's good guidance. And it says, we really recommend people have the opportunity to be evaluated at a specialized NF clinic like the one at Boston Children's or MGH. And they should also get regular screenings for various complications. And what I mean by screenings is checks when you are healthy to see if you might be developing something. And sometimes this looks just like the care for anyone would, like blood pressure. No matter who you are, you get your blood pressure checked when you go for your annual physical. But there's some NF1 specific information people might need to know, your primary care doctor, reasons that you might have high blood pressure that could be related to NF1, or it could not be. There's other things that might be specific to NF, like doing a skin exam to look for any new or bothersome skin tumors. And there can be things to look for just certain populations. So eye exams, which we recommend in our younger kiddos to see if their vision is changing and to see if they might have an optic pathway tumor, and breast cancer screening, which, as you know, most women are recommended, but for women with NF1, we recommend starting 10 years earlier, so at 30 instead of 40. So lots of little things that doctors need to be aware of, where even though if it's not a totally different screening, there might be NF1 specific information that they need to know to help manage someone's care. And unfortunately, though, where I come in as a health services researcher is how do we address the fact that a lot of people aren't getting these recommendations. So in terms of access to clinics, I think a lot of you are here because you come to our clinics, but in work that we did surveying people who are in the NF registry, so the registry run by the Children's Tumor Foundation, only about half of kids and a third of adults in the registry said that they had been to an NF clinic. So a lot of folks are really not getting their care from these specialty clinics. And there's a lot of reasons for that. Traveling is one. There aren't that many clinics across the entire US, and they're not evenly dispersed. In this picture, the red dots are NF clinics this is a few years old, so there's more now. And the green dots are people. So you can see that mismatch in kind of where people live and where people are getting care. And this means that people have to drive a lot of times a far distance. We found on average 51 miles. And that was even more if you were trying to see a high volume, like a very specialized clinic for your disorder. And also same for adults, needed to travel a lot farther. Are you looking for something? Okay. There are other reasons. It's not just travel. We know from our survey, a lot of adults said their insurance wouldn't cover the NF clinic they wanted to go to, or sometimes parents said they didn't even know that NF clinics were an option yet, right? That hadn't come up in their care journey. So there's a lot of reasons why people might be being managed outside of NF clinics. We also know that not everybody gets the health screenings that are recommended. Even though we have this great guidance and the NF specialists supported it, we did a survey and we asked folks, have you gotten these things? So some of these samples, did you get your blood pressure checked in the last year? Has someone told you about your family planning options or offered to talk with you about that? Has someone checked your back? Had you been forward to look about scoliosis? And you can see the percentages here. A lot of folks were saying that they actually didn't get those in the past year. Some, of course, limitations to this data. We did this survey in 2021. COVID was a crazy time for healthcare for everyone. But even if these numbers are not precisely right, I think it shows the point that unfortunately not everybody is getting every care recommendation all the time. And so really that led us to the research question of how can we improve people's receipt of these, what we call health surveillance, this kind of screening, this basic monitoring of whether they're having NF issues, knowing that most people aren't going to come to the NF clinics. So maybe the answer has to be outside of those clinics. And really that possible answer we wanted to study was, can we teach both people with NF1, their parents, their caregivers, and themselves, and their local primary care physicians about these care recommendations and help those primary care docs take on some of this screening and do it as part of annual visits? And we actually got this idea learning from other genetic conditions. We have a collaborator, Dr. Brian Scotko, runs the Down syndrome clinic here. And this is how we kind of got the idea. People with Down syndrome have a similar care issue in that many of them don't see specialists. They rely on their primary care physicians to take care of them. And they created educational materials for primary care docs and the people, parents and caregivers of individuals with Down syndrome to teach them about these care guidelines, and found in a national trial that this was really successful. It led to more of the recommended care being completed. The PCPs liked it. They said that they were interested in this information. Caregivers were happy. And we said, well, that seems like a really promising approach. Let's not reinvent the wheel. Can we do that same thing for NF1? And so right now we are running 2 trials to try and do this. And I wanted to give a lot of credit. First, our first kind of step in this process was, well, let's create the materials we would need about NF1. And we worked with, on the top here is our patient and parent advisory board. So these are 5 people either with NF1 who have a child with NF1 from across the country. We have 4 primary care physicians, so both pediatricians and adult doctors down here who have helped us make these materials, and some NF experts you might recognize, including Dr. Korf here on the right. So all of us came together, including the research team and these folks, to say, what is the education? What do people need to know about the care that they need? And let's make some materials that we think will be easy for them to use, easy to understand, and could help them get that care. And so now we're actually testing this in 2 different studies. The first trial, which is called the My NF Guide trial, you might have seen some flyers for it outside, is really trying to focus on improving care for people beyond NF clinics. So this is only for people who don't go to an NF clinic, and it's a totally virtual trial. No travel here required. We can send people online. They take a survey to let us know kind of about what their life is like and their symptoms. And then they get letters. We're testing 2 different versions of these letters, so they'll get one or the other. And they get a letter for themselves about kind of their care, and they get a letter for their doctor. And then we ask them to go to their annual visit with their pediatrician or primary care doctor, share that letter with the doctor. And then after they come back, we give them another survey and say, what happened at your visit? Did you get the things that we think that you should have got? And we're doing this to test to see if either of these letters is better at improving care and does it successfully work. And I'm really excited. It's an ongoing study. We're trying to get a lot of folks, so 360 people, adults and kids, from all over the US who haven't been to an NF clinic but are about to see their PCP. And if this is successful, we have plans to roll this out public for free. So it's a very exciting initiative, and hopefully in a future symposium, I'll be able to tell you that it definitely worked. In addition to that, we're running a second study because this is based on the study I told you was about written materials about your care, so letters. But we know not everybody learns the best reading a letter, and sometimes people want, different interactive information. So we were thinking, especially for adults with NF1, we know many of whom might have learning challenges or other issues. Is there another way we could help them prepare for their annual visits with their PCP? And so we're running a companion study where people get exactly what was in the prior study. They get these letters for their doctor, but they also get either access to educational videos, so videos we filmed kind of acting out the care guidelines and explaining why they're important, or a call with a peer navigator. So Stephen Sheard is an individual himself with NF1 who's trained as a patient advocate, who helps walk people through the information and kind of prepare for how they want to use it. And we're hoping to see if that is more effective at helping people really use this information and understand it. And so that is actually a study that's also ongoing. And this actually, you can be a patient at MGH or BCH and still enroll. So if you're interested, please let us know. We have some flyers, and we're specifically recruiting just adults with NF1 before their PCP visit to test this out and see if this helps. So I'm happy to take questions if people have them about this kind of initiative to help educate patients and their PCPs about care. If you're interested in participating, I wanted to flag all of the people in our lab. If you call, these are who you're talking to. It's our wonderful team. We're also, I didn't mention this, but currently working on rolling out all Spanish language versions of these materials as well, to have this be accessible to both languages. And even if you're not eligible because you are one of the people who goes to MGH or BCH and can't sign up for our trial, please help us spread the word. We are trying to be one of the first trials to definitively get people from all 50 states, and we're doing pretty well. You can see the red right here. So that's our goal, is by the end of the year, we hope to sign people up from all over the country and really try to move the needle for folks, not only locally here in Boston, but across the US, and really help them with their care. So I want to just give thanks to all of our huge amount of team that makes this happen, and our funders, which includes PCORI and the Department of Defense. And I'm happy to, and of course, thank you to all of our study participants who give their time to do this. We couldn't really do this research without you. And we hope it really makes a difference for future patients in their care. And with that, I'll take any questions.